Have you been pregnant for several weeks? You missed your period? Your urine pregnancy test is positive? And yet, the doctors do not see your baby in the scan. This video is for you. Stay tuned and watch this video right until the end. Hello and welcome to the Ask Dr. Ettang YouTube channel. My name is Dr. Ettang and I'm a family doctor working here in South Africa, and I make videos to answer your questions on different health conditions to provide information and value to you. If you want your questions answered in one of my subsequent videos, check the description below this video on how you can submit your questions to me. So let's get started on today's question. I have a question from OA. She says, "Hi, Dr. Ettang. I'm a 32-year-old woman residing here in the Eastern Cape of South Africa. I am pregnant. I missed my period. I did a home pregnancy test and it was positive. I also went to the hospital where a urine and blood pregnancy test was done and both turned out to be positive. I went for a 9-week scan with absolutely no bleeding. Pregnancy symptoms were all there: sore breast, food aversions, cravings, morning sickness, etc. The hospital scanned me and told me that I have a sac, but there is nothing in there. Doc, it's several weeks now, and there is still no baby in my womb after going to many general practitioners for a scan. I'm not in any pain and I'm not bleeding, and I've never bled. Each time, my pregnancy test is still positive. Doc, where is my baby?" The condition described here is a condition we call a blighted ovum, and recently it's now being referred to as an anembryonic pregnancy. So, what is a blighted ovum? A blighted ovum is a condition where a woman gets pregnant after the sperm and the egg unite. The sac and the placenta grows, however the baby does not. What subsequently happens is that it resorbs, and what you have left is an empty gestational sac. Now, this happens after sex and an egg is fertilized and attaches itself to the uterine wall, but the embryo has stopped growing. So we use the term anembryonic pregnancy as there is no embryo or a developing baby. And because this blighted ovum still makes hormones, the pregnancy test is still positive. And the woman experiences all the symptoms of pregnancy, including a missed period, nausea, vomiting, swollen breast and painful breast, fatigue, mood swings, bloating. A blighted ovum causes about 1 out of 2 miscarriages in the first trimester of pregnancy. You see, a miscarriage is when a pregnancy ends on its own within the first 20 weeks of the pregnancy. So what exactly causes a blighted ovum? See, when the egg is fertilized, the cells that make the pregnancy sac and the placenta start multiplying. So when the egg is fertilized, cells that make the pregnancy sac and the placenta start multiplying. But occasionally, the cells that are supposed to develop in the baby, they don't multiply. The cause is not always known, but sometimes the miscarriages that are caused, or miscarriages from a blighted ovum, are caused sometimes due to defects of your chromosomes, and chromosomes are those structures that carry the genes. Sometimes the lady's egg wasn't healthy. Sometimes there's a problem in the quality of the sperm. Sometimes it's due to abnormal cell division. But regardless, your body stops the pregnancy because it recognizes that it is abnormal. Now, I want to speak to anyone who has experienced this. Please don't blame yourself. I know that after miscarriages, some women have thoughts going through their minds like, what should I have done? What if it's because of this? Or what if it's because of that? Please know that those kinds of thoughts are normal, but it is not your fault. How do you know if you have a blighted ovum, and when is a blighted ovum diagnosed? Well, you need to undergo an ultrasound scan. Sometimes it is picked up during a routine ultrasound, and this is particularly difficult for women who have gone for the ultrasound expecting good news. At other times, they may have been bleeding at the start of the pregnancy, and an ultrasound was used to investigate the cause of the bleeding. If you've been diagnosed with a blighted ovum, what happens next? Is there any medication or injection you need to take to make the embryo grow properly and become a normal embryo? Sadly, there is no way to make an anembryonic pregnancy grow into becoming a normal pregnancy. Also, I need to repeat and stress this. There is nothing you could have done to prevent yourself from having an anembryonic pregnancy. So if you've received a diagnosis of a blighted ovum, you need to discuss with your doctor on what to do next. For many women, the pregnancies become aborted on its own without anything done. For some other women, they will require certain medications to be taken, which may facilitate the removal of the pregnancy. For some other women, they may need to undergo what we call a manual vacuum extraction. However, some women may have to undergo a surgical procedure called a dilatation and curettage, or a D&C. You see, this surgical procedure involves dilating the cervix and removing the contents of the uterus. Because the D&C immediately removes any remaining tissues, it may help with the mental and physical disclosure. It may be helpful if your doctor sends the product to a pathologist to examine the tissue to confirm the reason for the miscarriage. The bottom line is that it has to come out. Even if it stays there for 9 months, it will never develop into a baby. I'm sure you've heard stories in the village of ladies who get pregnant, and when they say, "Yo, my sister-in-law, oh, my neighbor, oh, my landlady tied my womb, that even after I got pregnant, I couldn't give birth." Please, it may not be witchcraft. You might actually be having a blighted ovum, and I advise you to speak to your doctor. So, how does one prevent herself from getting a blighted ovum? The truth is, there is no straightforward mechanism to prevent one from getting this condition. However, if you do have the funds and it's available where you reside, you can consider doing things like a pre-implantation genetic screening, or you can do a sperm or seminal fluid analysis to assess the quality of your partner's sperm. Or if you're a woman, you can also do a follicle-stimulating hormone test and an anti-Mullerian hormone test. How long must I wait after a blighted ovum to become pregnant again? Usually, I advise my patients to take about 2 to 3 months before attempting to get pregnant again. However, your doctor will be the best person to advise you and guide you as to what to do. So, what questions should you ask your doctor if you have experienced a blighted ovum? Listen, I must tell you that losing a pregnancy is a very upsetting and confusing experience. And there's a tendency to make poor decisions without asking questions. Do not be embarrassed to ask your doctor any questions. It is completely normal to have questions and feel emotional during this time. Here are some questions you may ask your doctor after you've experienced a blighted ovum. Is it possible that I can let my body miscarry, or should I take a medication to induce a miscarriage? How long am I expected to bleed or have cramps? What are the risks of miscarriage or future miscarriages? Must I have a D&C? Are there any risks associated with the D&C, and what are they? Is it possible that this will happen again to me? How long after this can I start trying to conceive? Do I need to come back for repeat ultrasound? Well, this list is not exhaustive, but these are some questions you should ask your doctor should you be in this situation. Well, thank you for watching this video. And if you like your questions to be answered here, like I answered OA's questions, please do not hesitate to contact me. In the description below, there is information on how you can send your questions or how I can set up an appointment for a free consultation with me. Thank you very much and have a wonderful day. God bless you.